A man aged 65 or younger, if he has no issues and suddenly experiences hearing loss in one ear, accompanied by dizziness or not, or if he says, "I was hearing fine today, but tomorrow I woke up and can't hear," he should not wait until the next day. He must see a doctor on the same day for an examination. It could be due to reasons like earwax or similar issues, or there might be a problem in the inner ear with the nerves, leading to sudden sensorineural hearing loss. Within 3 days, a person can lose a significant amount of hearing to the extent that they feel they can't hear at all. It's crucial to start treatment to save the auditory nerve before any permanent damage occurs. This is one of the important things. No one should say, "I don't have any issues," and suddenly their ear stops hearing and they wait for 1, 2, or 3 days. If we start treatment on the first day, it's different from starting on the second or third day. This is a case where as soon as a person feels that they don't have a cold or earwax and one ear suddenly closes, with or without dizziness, and it happened today when they were fine yesterday, they must get checked immediately. We need to see, because if we delay treatment, it might result in the ear not hearing for the rest of their life. Peace be upon you, doctor. My ear is blocked, and I'm not hearing well. This complaint is common among those who visit ENT doctors, whether it happens suddenly or gradually. There's a problem with hearing. The person isn't hearing well. What could the issue be? We know the ear consists of an outer ear, which includes the auricle, the ear canal, and the eardrum. Then there's a space called the middle ear. The middle ear receives air through the nose via a canal that connects the nose and the ear. In the inner ear, there are nerves and sensory receptors that allow us to convert sound into electrical signals that go to the brain, enabling us to hear well. So, any problem in the pos ear canal, the auricle, the eardrum, or the middle ear can weaken hearing, reducing the efficiency of sound transmission. This means the sound doesn't reach the part that senses it. Additionally, any disease affecting the inner ear will allow the sound to reach, but it won't reach the brain because it doesn't get converted into nerve impulses or electrical signals that reach the brain. In short, if someone isn't hearing well, the first thing we check for is if there's an ear infection, if their ear is blocked, if they have itching, or if there's wax inside their ear. If the hearing weakness is accompanied by pain, it's likely due to an infection, as inflammation can cause such issues if it's in the ear canal. Inflammation can cause this if it's in the middle ear. If someone has a cold, a severe cold, and with this inflammation they feel pain in their ears and then can't hear well, they should immediately see a doctor. This is because inflammation, whether in the ear canal, requires cleaning, and if it's in the middle ear, it needs to be addressed before it causes a problem with the eardrum. Or a perforation in the eardrum might occur. Then, the cold that accompanies it blocks the ear and reduces hearing, so it's necessary to visit the doctor. The issue can be easily resolved, God willing. Now, are there cases without pain? Yes, it is possible for someone to have a bit of wax in their ear. People who are used to cleaning their ears frequently or produce a lot of wax know this issue. Their ears get blocked, but there's no pain. They're just blocked and ringing, and that's it. Therefore, when visiting the doctor, we apply drops to soften the wax before going. When the doctor cleans it, either by suction or washing, the problem is resolved and hearing returns to normal. Is there anything else? Yes, foreign objects in children's ears. A child might put something in their ear, which can cause them not to hear well with that ear. Children often have a common condition associated with the presence of adenoids, where the ventilation tube I mentioned, which delivers air to the middle ear, gets blocked. This results in a condition called fluid behind the eardrum. So, a child with tonsils and adenoids who snores while sleeping and whose parents notice he isn't hearing well likely has adenoids affecting his ear, causing fluid behind the eardrum. In this case, a checkup is necessary to determine whether to remove the tonsils and adenoids or also insert ventilation tubes to drain the fluid behind the eardrum. After a period of time, it resolves on its own. People who know they have ear diseases, like those with inflammation in the eardrum or those with decay and ear bones issues, tend to have hearing loss and discharge from the ear. The patient should be aware that if they have inflammation in the eardrum, they know that the hearing in that ear is not good and it whistles. The treatment is to know when it will improve and when they will hear well, which is when the underlying problem causing the discomfort is resolved. I mean, perform a procedure to patch the eardrum if it needs patching, perform the removal of ear bone decay and the mastoid cough if there is ear bone decay. The procedure is done, and afterwards the person is healthier. In cases of ear bone decay, hearing may not be as strong as normal after the procedure. But there is a method, of course, where hearing is good. And in cases of decay, we give certain treatments or compensate for hearing in one way or another, either through another procedure to repair hearing or with a hearing aid. All of this, doctor, are simple things we know. What else could cause a person not to hear well? One of the very common issues is nerve problems. These nerve issues appear without any disease at the age of 65. You find that when a person reaches, 65, their hearing starts to decline. The hearing that declines is not due to wax, inflammation, or needing treatment at all. The whole story is that the nerves and sensory receptors in the ear weaken with age because they have small parts that, due to extensive use, bone decrease in efficiency, and the cilia and tiny hairs in the inner ear stop functioning properly. Therefore, at that time, the patient needs a hearing aid. So, an elderly person who is 65 years old and doesn't hear well should first visit a doctor to ensure there is no wax or any other issue. Secondly, they might need to wear a hearing aid to hear well, and that's it, nothing more. Now, the last thing I want to tell you is very, very important. A man who is over 65 years old, or even younger, and is not a child and has no issues, suddenly experiences hearing loss in one ear, possibly accompanied by dizziness, or the ear that was hearing well today suddenly can't hear the next day. He shouldn't wait until the next day. He must see a doctor on the same day for an examination. It could be due to reasons like earwax or similar issues, or there might be a problem with the inner ear or nerves, leading to sudden sensory or neural hearing loss. Within 3 days, a person can lose a significant amount of hearing to the extent that they feel they can't hear at all. It's crucial to start treatment to save the auditory nerve before any permanent damage occurs. This is one of the important things. No one should say, "I don't have any issues," and then suddenly find that they can't hear with one ear and wait for 1, 2, or 3 days. Starting treatment on the first day is different from starting on the second or third day. This is a situation where, as soon as a person feels that they don't have an ear infection or earwax buildup, and one ear suddenly stops hearing, with or without dizziness, they must act immediately. And if this issue doesn't improve, and it happened today, while you were fine yesterday, then it's necessary to get checked immediately. We need to see what's going on because delaying treatment might result in that ear not hearing well for the rest of your life. We should pay attention to the elderly when it comes to sudden hearing loss. Older people shouldn't be bothered by using a hearing aid. We understand that it doesn't allow a person to hear like a natural ear, but it's the solution we have for nerve weakness that occurs with aging. Children who have adenoids and tonsils, when they complain of hearing weakness, it's necessary to quickly proceed with surgery to prevent fluid from accumulating behind the eardrum. If it does occur, we should extract it. Lastly, for newborns, it's preferable to ensure within the first month that we check carefully whether they can hear or not. You might ask, "Doctor, how can I know if a 1-month-old child can hear?" There is a test conducted by an audiologist. The test determines whether the ear is hearing or not, because if there is a hearing problem in the first months of life, a decision must be made quickly so that the child can hear and learn to speak. We shouldn't wait until they are 1 or 2 years old and then say we didn't notice. Every newborn must have a hearing test to ensure there are no issues. Wishing you all the best. If you like these videos, give us a like and subscribe to the channel so we know you're waiting for more videos from us. Wishing you all the best.